All right, take two, sorry. Take a moment to think back to some of the worst times in your life. Maybe a family member or a friend died. Maybe you went through a really hard breakup. Now imagine somebody handed you a solution that for 1 hour took away all that pain. That temporary escape from reality is what sparks addictions in millions of people all across America. It stems from vulnerability and pain. I've seen this pattern occur in many people I care about, and witnessing it has taught me that addiction is an illness that stems from the absence of hope and support. Today, I will inform you about the truth about addiction, as well as why and how you could support people struggling. I've witnessed the progression of addiction in friends and family, as well as having done extensive research on the topic. I will begin by explaining how judgment and ridicule harms people that are struggling with addiction. Then I will go over how addictions start, and finally, why and how you can help people with addictions. First, I will talk about how societal pressures and judgment severely worsens the problem. People judge others before they understand them. According to the National Institution of Health, when people use terms like junkie or addict, it insinuates that the person is the problem rather than that they have a problem. You should say person with substance disorder instead. When people are afraid of getting in legal trouble as well, they hide their addiction instead of reaching out for others. Additionally, when people are shamed, it causes the need for the substance to worsen. Additionally, the idea that it is their fault is wrong. When people start doing drugs, they don't want to get addicted. They're usually using it to mitigate underlying pain or traumatic experiences. When people receive harsh reactions from their family or even family rejection, their risk of homelessness is multiplied by many. And according to the American Addiction Center, it can be more challenging for people who are homeless to stop using substances because they don't have easy access to treatment, often have smaller support circle networks, may have decreased motivation to quit drugs or alcohol, and may have other higher priorities such as finding housing or food. Also, the way the law treats people with addictions makes the problem worse. The criminalization of people with addictions ignores the reasons the addiction started and causes societal judgment. If we decriminalize people with addiction, society would stop seeing them as addicts or junkies and more like people, promoting them to get better help and support. In places like Portugal and Switzerland, this has already been implemented and proven to work. Switzerland decriminalized people with heroin disorders and to put people's health and safety over the law. They also started a program in the 1990s called the Heroin-Assisted Treatment, in which the government would give heroin to addicts in a safe area to help them quit without risk of overdose due to medical supervision. Now we know judgment is the problem, but how does addiction start? Addictions start from emotional pain and biological factors as well. Most addictions start with self-medicating socially acceptable drugs. During the mid to late teen years, most people get offered stuff like weed or alcohol, and while in moderation, both are fine. Sometimes people abuse them in order to escape reality and such. According to the American Addiction Center, over 97% of the people with addictions to harder drugs started with weed, alcohol, or tobacco. This is why they're commonly seen as gateway drugs. Addictions also come in phases. They can be unnoticeable until it's too late, before it's too late. I'll explain the phases. The choice phase is where an addiction sparks. Someone might try drinking or smoking out of curiosity or to try to fit in with their friends. During this phase, they often feel in control or that they could stop whenever and has no consequences. Next is the coping phase. This is where the person stops using it for fun and realizes that it can be used as a tool to help mitigate stress, help them go to sleep, and stuff like that. And finally, after long enough, the brain becomes dependent on the substance just to feel normal. People start shifting their day-to-day focus onto that drug, and at this point, an addiction is formed. Genetics can also be a factor. Substances release dopamine, the endorphin that causes happiness, and some people have naturally less dopamine receptors. So when they try a substance that mass produces dopamine, it's unlike anything that they've ever felt before, causing them to want it more than the average person. According to the proceedings of the National Academy of Sciences, an imbalance between dopamine receptors and those that underlie executive function contributes to the compulsive drug use and loss of control and addiction. People with mental disorders like ADHD, anxiety, or depression have a higher likelihood of self-medicating. This increases the risk of addiction development because it gives people a reason to use a substance that they find reasonable. So if the problem is judgment and the cause is pain, then what's the solution? In order to minimize addiction, show compassion, educate others, and support systemic changes. Be someone that people can open up to and be vulnerable around. Being a supportive figure in someone's life can be the difference between somebody going off the deep end and them trying to reach out for support. Oftentimes, the thing that people struggling with addiction need is someone who cares about them and genuinely understands the problems that they're facing. If your friend ever comes to you about their struggles with addiction, they're scared. They don't know how you're going to react, and they don't know if they're going to think you're going to think of them differently. You need to show them that as their friend, you care about them and want them to get nothing but support and become better. You can also support systemic changes and educate people around you. You can support local groups like Gauchos for Recovery, who I'm sure you guys have all seen in Isla Vista giving away free fentanyl testers or Narcan. You can go to their website and even just donate $1 or something, just anything to show support. Additionally, you can educate the people around you. Teach people the proper terminology that I went over earlier when talking about addiction. If somebody ever starts insulting somebody for having an addiction, you can remind them that addiction is actually classified as a chronic brain disorder, similarly to like the autistic spectrum disorder. You can ask them like if they would insult somebody with autism for having autism. And finally, people will be extremely grateful for your support. If you're wondering why you should care about addiction, remember that it's a lot more common than you think. According to the American Addiction Centers, 1 in 7 young adults is actively struggling with addiction. Think about your friends. If any of them is struggling with addiction, I'm sure your support would mean the world to them. Additionally, helping people just feels good. Being the person that somebody trusts that much shows that you're a good person. It shows that your character is good. Finally, you never know where your life is going to go. There might be a time in the future where you're going through something terrible and need somebody to talk to. And I promise you, the people that you support are going to be the people that come to support you. Now to wrap everything up, today I explained how society treats addiction directly impacts the recovery process and how addiction starts and what you could all do to help. I hope the points and information I shared were enough to convince you to support people with addiction. And remember, nobody is perfect. Sometimes people make the wrong decisions, but nobody chooses to get an addiction. But you guys can all choose your responses to that.